What is epilepsy?
Oh, epilepsy.
Yeah.
Epilepsy is a chronic brain illness that makes people who have it fall, shake. When they fall, they have loss of consciousness. They shake their body, and after a short time, they regain their consciousness. And that is not the only thing. They can present, epilepsy can present with seizures, but in many different ways.
Is epilepsy uncommon?
Uncommon?
Yeah.
No, it is very common. Actually, in Kenya, out of every 100 people, you can find at least 2 people who have epilepsy. Yeah, that is like 1 million people in Kenya.
In Kenya. How does one help who is having a seizure?
It depends with the type of epilepsy that person, or the type of seizure that the patient is experiencing at that point. So commonly, we will always find people who will fall with loss of consciousness, jerking the whole body, and probably having a lot of saliva coming out of their mouth. So the first thing you do, of course it is dramatic, be calm. That is the only way you're going to be able to help that person. Secondly, look for something soft to put under the head of this patient, because he's having a seizure, banging the head. You want to protect the head. Third thing, try and loosen tight clothing around the neck. If they have glasses, you can remove them or put them aside. And then wait until this patient stops having a seizure. At that point, when they are calm, then you can roll them on their side, and so that the saliva from their mouth can flow out freely. Yeah.
And is it contagious?
Epilepsy is not contagious.
Yes.
You can never give another person epilepsy. As you said, it is a brain condition, and there is no way it can be transferred from one person to another.
Okay. Can someone swallow their tongue during a seizure?
Okay. Sometimes when a person has a seizure and they are left lying on their back, the tongue can fall behind the mouth or towards the throat, but it is impossible to swallow one's tongue. You can't swallow the tongue, but it can fall back, and if it falls back, it blocks the windpipe. So breathing becomes very difficult. It's important to roll them on their back so that if the tongue has fallen back, it will fall on the side.
How can you identify epilepsy?
Oh, epilepsy is identified by the seizures. You will always know this is epilepsy by how it presents itself. First, there will be seizures. These seizures will be repeated, and they will, because there are very many different types of epilepsies, you can identify the type of the epilepsy according to the seizures that they are having, and also the pattern that it takes. It has to be repeated, and it has to fall into a particular type of epilepsy.
How is epilepsy treated?
Treated?
Yeah.
That is a very good question, and it's a question that we'd like every person to understand. If a car is sick, it's taken to a mechanic. If what else? Whatever. If anything goes wrong or a house is broken, a mason comes to make it up. So if the body is broken, which is in the case of epilepsy, it's an illness, a brain condition, it needs to be taken to a doctor who will diagnose, say whether it is epilepsy or not. If it is epilepsy, then the doctor will start the correct treatment.
Okay. Can people die from epilepsy?
Sadly, there are cases that have been found. People have seizures probably at night, and then they die from that. Maybe, as we said, the tongue can, the person, when the person is having a seizure, they laid on their back, the tongue fell back, and there was nobody to roll them on their side, so it blocked their windpipe. They were not able to breathe. There is a way sometimes the heart beats. So during a seizure, sometimes the heartbeat can change, making it very fast or very slow, and the person might die from that. And the person can die from falling in water bodies, on the fire, things like that. Is how people with epilepsy can end up probably dying from a seizure.
Do epileptic patients have developmental disabilities or psychological difficulties?
Okay, I don't like calling them epileptic patients. They are not epileptic patients. They are people with epilepsy.
Okay.
Epilepsy is a very small part of who they are.
Yes.
So, that one is, I wouldn't say that they do, and I can't even say that they don't, because epilepsy, being a brain condition, and the brain is the one that takes care of the rest of the body. So sometimes, if left untreated, and the person is having too many seizures, they start regressing. Their development is compromised. Their cognitive way of their thinking is compromised as well. So yes, the epilepsy can lead to that if left untreated. But when it is very well treated, nobody even will ever know that that person has epilepsy in the first place.
Okay. Are there different types of epilepsy?
Oh, there are many different types of epilepsy, actually more than 40, which are recorded. So yeah, there are many different types of epilepsy. And most importantly, that is why the reason why we need to take epilepsy to the hospital, it is because the different types are treated differently. So take the person to the hospital so that the type of epilepsy can be identified, so that it can be given the correct medication.
Can animals also suffer from epilepsy?
Animals, they do suffer from epilepsy. They have a brain. Everyone who has a brain can get epilepsy. Animals have brains, so they can actually get epilepsy. Yes, they do.
Okay, what is a seizure?
A seizure is in a very kawaida way of explaining, is the manifestation of what is happening in the brain. So, like the brain starts having very uncoordinated movement. You know, the brain always goes probably in one direction, but right now, at the moment when the person is having a seizure, it starts having uncoordinated messages, movements in the brain. So that is what we call a seizure. And so whatever is happening in the brain is also seen outside. So if the part of the brain that is having a seizure is the one that controls the body movements, so you will start seeing a person having a jerks. Yes. If it is the part of the brain it controls our thinking, you will start seeing the person is not thinking correctly. So a seizure is the manifestation of what is happening what is happening in the brain. Yeah.
What triggers seizures?
Seizures can be triggered by very many things, and actually anything can trigger seizures. It just depends with the individual. So there are individuals whose seizures will be triggered by extreme cold, other individuals extreme heat, others stressful factors, alcohol, ladies, their hormonal imbalances, they can trigger seizures. So virtually anything can trigger seizures. It depends with the individual.
Are seizures painful or dangerous?
Dangerous, yes, they are, because when the person is unconscious, depending on where they're going to fall, they can fall from heights, they can fall from fire. That is dangerous. But no, seizures are not painful. Yes. The person at the ictal phase, when the person is having the seizure, they don't feel any pain. Yeah, but they can feel pain depending on if they fell in dangerous places. Yeah.
What is the difference between epilepsy and seizures?
It is very, very important for everybody to understand there is a difference between epilepsy and seizures. Yes. So epilepsy is the tendency to have repeated seizures without any cause. But seizures, a person can get seizures from different other things apart from epilepsy. So a person can have seizures because their sugars are low, because their potassium is high, because their calcium is low. Those ones can bring seizures. And sometimes because they have meningitis. Not everybody who has meningitis has epilepsy. Actually, epilepsy can come because of the meningitis. So seizures, every person who has, or maybe the easiest way of explaining the difference between a seizure and epilepsy is to say everyone who has epilepsy has one or another type of seizure, but not everyone who has seizures has epilepsy.
Okay. Please explain or describe Anger outbursts due to epilepsy.
Well, anger outbursts in epilepsy, I think maybe mean people with epilepsy having
Yes,
anger outbursts.
yes.
Yeah? So yeah, sometimes if people with epilepsy, they are not understood. And not just people with epilepsy, anyone who feels like the other people don't understand them, they tend to have anger outbursts. Probably in the course of explaining whatever they are going through, it's difficult for people to relate. So yeah, people with epilepsy might have anger outbursts because they are not being understood by others. And people with chronic illnesses, which epilepsy is also a chronic illness, they tend to have depression sometimes. Yeah, and depression especially. So yeah, because of this illness, people they will start asking themselves, how long will I have this? Why did it have to be me? Sometimes it can develop into depression. So people with epilepsy are known to have depression, and if sometimes they have anger outbursts, it's we call it like a bipolar disorder where sometimes they'll be very hyperactive, sometimes they are very depressed. So yes, people with epilepsy can have anger outbursts, especially when they're not being understood, and also because they have a chronic illness.
Okay, what about memory loss with people with epilepsy?
I saw an article some time back that it explained very, very well. Memory is stored in some parts of our brains.
Yeah.
Sometimes that part of the brain where memory is stored is the one that is affected, or where the seizure starts from. That one can cause memory lapses. Also, the drugs, the medicine that the people with epilepsy are taking, some of the side effects known are loss of memory lapses, because they are going to treat that part of the brain where is already having the memory lapses. So yeah, the seizures can rub the memory, and also some of the anti-epileptic drugs that are known, their side effect is memory lapses.
What causes one to be an epileptic?
There is not one person who is epileptic. I have never come across an epileptic person. A person can have epilepsy, but a person can never be epileptic.
Can never be epileptic.
Yeah.
Okay. What is photosensitive epileptic?
Photosensitive epilepsy is when a person's seizures are triggered by light. So it's either flickering lights, most of the times it's flickering lights, or sometimes a changing from darkness to light, from a dark place to a light place. So that is photosensitive epilepsy.
Okay. Can just watching a movie trigger epilepsy? And if yes, how and why?
Okay. Watching a movie can trigger seizures and not epilepsy. Remember, there is a difference. Seizures can be triggered by watching a movie, because the scenes in a movie, they can act like photosensitive light, because they are darker scenes, they are brighter scenes. So that change in the lighting is what triggers the seizures.
Okay. What are the best methods in alerting the public of epilepsy? How?
The best methods probably is like exactly what we are doing. But every person who knows something positive about epilepsy, if they would take the initiative of telling the next person who does not know, very many people would know. That is one thing. We can also use media, like radio shows, TV shows, to educate people. We can use public places like the churches, the chiefs, barazas, the schools, especially primary and high school, and even tertiary level schools. And even instead of, once in a while in our social media circles, in our Facebook, Instagram, and Twitter, all this, you can take anyone who knows something positive about epilepsy. They can take that time to talk about, or even blogs, they can take that time to talk about epilepsy and educate their friends who are in their social circles.
Okay. What is your advice to anyone concerning encouraging people with epileptics to live a life with no struggle?
I'd like to encourage the people with epilepsy to live their lives to full potential. If I didn't have epilepsy today and I develop it tomorrow, I would like everybody to treat me exactly the way they treated me yesterday when I didn't have epilepsy. So, and the way you'd like to be treated, if you have any condition, please treat the other people exactly the same way. People with epilepsy can live their lives to full potential if we all give them a chance. A balanced diet is very important because remember you're taking drugs and these drugs are strong. So for your body to be able to process the drugs well and for you to be able to be healthy and strong, you have to eat. A person with epilepsy needs to eat at least 3 meals in a day and snacks in between to help process the drugs and also to keep the person strong and healthy. Also, for children with epilepsy, we have a ketogenic diet, a diet that is high in proteins and fats and low in carbohydrates and sugars. This helps the brain to not to be very active, which helps the seizures to be less.